So good morning, everybody. Thank you for coming. I want to start out by reminding you that tomorrow makes 13 incubation cycles or 26 weeks since the first case of COVID-19 was identified in Pitt County. We were obviously working on COVID well before that, but it has been 26 weeks since the first case was identified here in Pitt County. Our case count as of this morning is 4,345. That's up 51 from Monday, the last time I pulled numbers and calculated rates for things. The largest group of cases continues to be among the 18 to 24-year-old age group. And that total case count represents a little over 2% of the Pitt County population in terms of the number of our residents who have been affected. As of Monday, we had estimated 3,309 had recovered. The recovered number continues to grow as well. That number is, I think, are we over 4,000 now? Approaching 4,000 on that, and that the updated numbers on our website. Our estimated case counts for estimated active cases are falling. So where we were running probably between 300 to 500 active case counts per day a couple of weeks ago during what we would call the ECU bubble, I guess. We got up into the 700s and actually at one point hit 1,200. So last week we were over 1,200 active cases in the county. Monday we were at 960. Yesterday we were in the 700s. That number is falling, which is a good thing. Our estimated active cases per thousand, as of Monday, we were down to 5.2. Last week, we were at 7, I think 7.1 per thousand in the county. So our number of active cases per thousand residents is falling as well, a positive indicator. Our total fatality count at this point is at 25. That is stable, with 56% of those fatalities in the 75 and over age group. And the 75 and over age group represents about 4% of our cases. So over half of our fatalities have come from 4% of our cases. Case fatality rate at this point in Pitt County is at 0.6%. Across the state, it's 1.6, 1.7%. So we are faring better from a fatality standpoint than the rest of the state. That has increased from last week, where we were at 0.5 last week, and it has floated a little bit between 0.5 and 0.7. As deaths come in, the case fatality rate will climb a little bit, and then as more cases, non-fatal cases come in, that dilutes it and it tends to drift back down. So it has kind of floated between that 0.5 and 0.7 throughout the epidemic. And the percentage of tests returning positive before the increase in cases with the reopening of ECU, we had been at 6 to 7%. For a couple of months, since probably mid-April, we had been at the 7%-ish to high 6% mark. We had hit into the mid-teens or high teens during the height of the ECU bubble or bulge. As of Monday, it was at 9.8%. This morning, the state has us listed at 9.1%. So our percentage of positivity is falling. We are still above the state percentage of positivity, which is now at about 5%. And those are my prepared comments for this morning. So happy to take your questions.
Dr. Silvernail, so we're coming into flu season. So when it comes to flu shots and vaccines and things like that, what are your comments towards that?
First of all, if you don't have a valid medical reason not to get a flu shot, please consider getting a flu shot. We want to try to protect as many people as we can from influenza this season. Influenza has a symptom pattern that is similar to COVID. Usually the onset of influenza is abrupt, very abrupt. If you've ever had flu, people say they feel like they've been hit by a truck or a train. High fever, sore throat, cough, shaking chills. It comes on very abruptly. Patients can usually tell you the day and time that their symptoms started. So it has a slightly different from that standpoint, but a great deal of overlap between the two and can be confused. So we want to try to take that off the table as much as possible.
Certainly, and so as we also start to see cooler weather now, how does that impact the coronavirus? As the heat seemed to have, you were able to kind of congregate. We were seeing people on beaches. It wasn't as big of an issue, but now with the cooler weather, what does that look like?
It seems like we certainly had hoped that the heat would kind of drive some of the coronavirus out. That really didn't happen. It was such a hot summer, people still congregated, but congregated in air-conditioned settings inside. And I think as we get into cooler weather, people will congregate into heated areas inside. So I'm not sure that the weather is going to have much impact on coronavirus. Numbers do seem to be drifting down nationally and in the state, which is a good thing. Hopefully that trend will continue.
And I believe my thing might have stopped recording. Can you just reiterate the flu shot vaccine?
Oh, sure.
Question I asked at the beginning.
Yeah, so in regards to influenza and the flu vaccine, we would encourage anybody who does not have a valid medical reason not to get a flu shot to get a flu shot. That helps take the potentiality of flu off the table for many folks in terms of deciding if your symptoms of influenza or are they COVID. As I said earlier, influenza generally has a very abrupt onset: fever, aches, chills, sore throat, cough. Most patients can tell you the day and time that influenza symptoms started.
Definitely, and I think you covered everything I was looking for right now. Thank you.
Okay.
All right, and you mentioned a little bit, about ECU's decrease, and it is my understanding that fraternities and sororities follow the same rules as dorms, so that they can remain open. But is your recommendation seeing those clusters in a lot of fraternities and sororities? Do you think that they should continue to be able to stay open, or do you think they're fine as is?
Well, we're working with Student Health Service, and they're working with the Greek Life houses on campus. Some of the houses have been very strict in their quarantine procedures in terms of not even allowing folks out of their bedrooms once they have cases in the house. So I think given the nature of college students to mingle, it's difficult to prevent spread in that population, but not impossible. And we're working with them to try to assure that the students are properly isolated and quarantined.
Okay, and there was a headline that I saw that thousands of North Carolinians were incorrectly told they have COVID. What do you think about that, and what are sort of some of your thoughts about that?
Data management certainly has been a struggle at the local level and the state level, throughout the course of this epidemic or pandemic. We had a data glitch here several months back, you may remember, where a lab reported about 40 cases and then the next day took them out. So when you look at our curve, you'll see one day where they go up about 39 cases, I think it was, and then the next day they removed 32 of those, and we had about 4 cases positive. So those things have happened, unfortunately. Nationally, that's been in the news too. At least here in Pitt County, we have not had a large number of folks that were erroneously notified of false results or incorrect results. We did have one issue of same name, with different results, and the calls went to the wrong persons, and that was corrected once it was recognized. So.
Okay, and sort of how common is it for tests to get mixed up when you're testing a lot of people? You mentioned that name difference, but is there other factors? Is it something that's super common, or just once in a blue moon kind of deal? Well,
I think if samples are collected and labeled properly and paperwork is done or electronic records are kept, that should be a rare occurrence. That's one of the things that many places are working on, including us, is how do we improve our data fidelity? How do we improve the speed of that? We're looking at ways to potentially scan driver's licenses and things like that to pre-populate our electronic record system so that that's in there, and then we can print labels that have barcodes and things like that facilitate the intake of those at the laboratory.
Okay, cool. And during this time of year, a lot of people complain about sinuses and that kind of deal. So is there any helpful information you can give people watching that would maybe say you have a sinus infection over COVID kind of deal?
Most people who have seasonal allergies recognize their seasonal allergy pattern pretty well. So if it feels like your normal seasonal allergies and you've been outside around the ragweed or the mold or cutting the lawn or something like that, it probably is your allergies and not COVID. Some people with allergies can even run a low-grade fever sometimes. So most people with allergies don't feel sick necessarily per se. They feel they have their sinus pressure, pain, nasal congestion. They don't usually have the body aches and chills and things like that, although sometimes they will run a low-grade fever with hay fever. That's where hay fever gets its name.
Okay, cool. And what are some of the major differences between, you mentioned this a little bit, but between COVID and sinuses? What's that maybe 1 or 2 things that you could be experiencing that you
I think someone who doesn't normally have nasal congestion or nasal symptoms, sinus allergies, seasonal allergies this time of year, who now has new onset of nasal congestion, sinus pressure, pain, cough, sore throat, things like that, those may be reasons to be evaluated for COVID or some other infection.
I still have many friends that go to ECU, and many of them have got coronavirus. They have left quarantine without getting a negative test because they said they were told by student health that they just need to have 2 weeks without symptoms. So what is the protocol for leaving quarantine?
That's true, Elizabeth. We don't have to test folks if they've passed through the quarantine period without developing symptoms. So if we identify that an individual is exposed today and we place them in quarantine, they would be in quarantine for 14 days. On the 15th day, they would be free to move about if they did not develop symptoms during that time.
Okay, so I test positive for COVID today,
Mm-hmm.
and I am put into quarantine. I do not need, and I have no symptoms. I
Mm-hmm.
can leave on the 15th.
So testing positive, the time frame's a little different. It's 10 days to recover once you're positive. So the criteria for recovery in someone who has tested positive with or without symptoms are that it's been at least 10 days since that onset of symptoms or the test, that there's been improvement of the symptoms, and that you've been fever-free for at least 24 hours at the end of that 10-day period.
Okay.
Okay, so the release from isolation, remember, we isolate people who actually have the disease, we quarantine people who have been exposed. So there's a subtle difference, but it's important from a public health law difference.
So you're put in isolation for 10 days before you can release.
Yeah, you'd be in isolation for at least 10 days. Now, if you were still sick at the end of 10 days, then that can be extended. But most younger folks are better and feel better in under 10 days. But to be non-infectious, the CDC recommends that they be at least 10 days from onset of symptoms or date of test.
Okay. And as there's many cases among the younger population, what does this mean for the older population in Pitt County? Are they more likely to get it?
Well, I guess it depends on how much intermixing there is. I think would encourage older adults to be careful about who they interact with, especially the college age group, since right now that's 40% of our cases are in the college age group. So people should consider how they interact with that age group. Obviously, some people don't have a choice if they have to encounter these folks in their role as faculty members, staff, or in their other professional life. But certainly taking the precautions of being 6 feet apart, wearing your mask, and making sure that you sanitize your hands or wash your hands after you have had contact with others or surfaces that are not your routinely clean surfaces in your home would be important in prevention.
So is it different for a vulnerable person to be around someone that is, per se, middle-aged or a younger person, or do they have the same chance of getting it from either of those people?
Well, we know that many cases are very mildly symptomatic or even asymptomatic. So we should, if they're folks that you're not normally around, not in your bubble per se, that you should consider them infected until proven otherwise. Right now, and I don't say that to scare people, but if you're, where we have seen these clusters in the community, we haven't really seen the workplace cluster. We've seen school clusters, daycare clusters with the children in those settings, generally brought in from outside, not being transmitted in the facility. But where we see our community clusters have been at private functions where people let their guard down. And they're friends of mine, but they're not friends that you live with or socialize with all the time. And we've seen a number of these settings, barbecues, birthday parties, baby showers, things like that, where people have come together and one of the participants has brought COVID with them unknowingly and spread that to other members at that function or the other persons at that function.
Okay, so even when it comes to visiting distant relatives, you should still keep your guard up. And how can you do that? Like, should you double mask, wear gloves? No, I'm serious.
I think one CDC compliant mask is all you need. I don't know that you need the double mask. Gloves don't really offer if you're handling something that's contaminated, gloves offer some protection to you. Most infections don't move through our skin. We rarely wear gloves to protect ourselves from bloodborne infections, things like hepatitis B, HIV, hepatitis C, things like that, where even small cracks in our skin can allow that virus to enter our system. COVID is a respiratory virus, and it needs to get into our respiratory system, so generally nose or mouth, but sometimes in eyes, which is a mucous membrane, could potentially be a portal for it into our body. So it's important to wash and sanitize. And even gloves, all gloves have some degree of penetration if they're worn long enough. Natural latex gloves have penetration the soonest, actually, because they're water-soluble. Latex is water-soluble. So the synthetic rubbers have a longer time to penetration, but eventually you'll develop micro abrasions in those gloves, and things will get through the gloves if you wear them long enough. So.
Okay. And there has been an increase in cases in Europe and India. So is that like a second wave, and should we expect a second wave in America?
Mm-hmm. Yeah, I'm not sure we're through the first wave yet. So I think COVID is part of the environment, and it's going to continue to circulate. Weather has not seemed to affect it. The thing that seems to have affected it are bringing groups together. So, we saw some increase in cases in Pitt County after Memorial Day and after 4th of July, where people came together and socialized. We saw an increase in cases when the ECU reopened and the students came back. So I think it's part of the environment that we live in. It's going to continue to circulate for a period of time. The good news is that there are probably some of us that do have some degree of natural resistance to it, that exists in almost any population of organisms to a threat. But most of us do not have resistance to it. So many of us remain susceptible to the infection.
And we are about to enter a holiday season, kind of with Thanksgiving and Christmas coming up. So how can we kind of mitigate these cases and try to prevent it? What can we do?
Mm-hmm. Again, I think holiday parties are going to look quite different this year. I don't think we'll be having large traditional holiday parties, the office parties, things like that many people have. Thanksgiving celebrations, if you're with your family that you normally live with in the house, I think those things will probably go on quite normally, and I'm not telling people not to celebrate Thanksgiving. But if you're going to bring large family groups together, you have to consider that if you bring together a large enough group, there's probably somebody in that group that's got COVID. And you've got to understand that even relatives can bring the infection to that gathering.
Okay. And kind of going back a bit, I know you said that we're kind of still in the first wave.
Mm-hmm.
At any point, do you expect this to slow down?
Well, like I say, the state trends are trending down. Our trends are countywide are generally on the downward direction right now, a favorable direction. As I said, I think at some point, we're not there yet. I think at some point COVID becomes just another infection that's in the environment that we are potentially subject to, but we're not there yet. We're still in a mode where most of us have not had this the first go round. And so if you look, we were kind of probably over a peak in the county here, and we're trending down like the state, whereas when we had the ECU bleb, we may very well have another bubble. Is that all part of the first wave or those second waves? Usually if you look back at, and the coronavirus is not the 1918 flu virus, that 1918 flu virus far more lethal. But if you look at that, there was a fall wave and then a spring wave. And many times when you look at the influenza surveillance, you'll see that there's a big spike of influenza. Generally, it occurs about the middle of January, and then building into mid-March into April, we'll build a little bit of a smaller, broader peak of spring influenza that seems to happen here reliably most years, and a lot of that seems to be flu B. Last year, the good news with that is last year when the protective measures went into effect for COVID, influenza dropped like a stone. So one of the things that I am hopeful for, but can't guarantee, is that the measures that we have in place to protect ourselves from COVID will impede the transmission of influenza and other respiratory viruses like COVID that are droplet spread.
Okay, so I've seen a lot of people compare the influenza waves to COVID. Is that fair to do at all, or is it completely different?
They're different viruses, but I think it's fair to compare. You know, a novel influenza virus is one where there's little or no immunity in the community. A novel coronavirus, little or no immunity in the community, and both of those would move in a wave, you know, through the community. In North Carolina, that wave has seemed to move from west to east. We have lagged behind the state. We've been about 2 weeks or so behind the state throughout this in terms of the rise in our cases. So also in the recovery and decline in cases, we're going to be behind the rest of the state as that wave continues to move east.
Okay, that was the last question for me.
Okay.
Kayla Menges with the East Carolinian. So I did some research on Pitt County's data,
Mm-hmm.
and I have some data-related questions and also seeking clarification and your opinion. So at the beginning of COVID-19, it was projected that the older demographic, specifically 65 to 74, would probably hold the majority of cases. And Pitt County, like you said, the 18 to 24 demographic is holding 40% of cases, while more so working class 25 to 49 holds 31%, and the oldest demographic holds in between 13 to 5%. Why would you say that it's so that the youngest demographic is the one that is holding the highest percentage?
The 18 to 24-year-old. I think, you know, the thing that we struggle with in public health with any public health threat is perceived risk. And I think that many folks in that age group perceive the risk of this infection to be very, very low, and may not be as careful in protecting themselves from it. And I think also just the nature of the college-age population. It's about getting to know other people, meeting other people, doing new things, spending time together. And I think that helps facilitate the spread of the infection.
Okay. I've also been following the COVID-19 DashNet, and last week, as of September 7th, Pitt County was ranked 6th in the 50 worst counties in the United States to have positive COVID-19 cases and populations greater than 100,000. As of Monday the 14th, it was 21st. As of today, we're officially the 31st county out of the worst 50 worst counties. Can you explain why you think there is a continued drop? And do you think we will continue to drop lower, practically drop off the scale, or maybe jump back up again? So
So we're, number one is the worst, or 50?
So number one would be the worst.
Would be the worst. Okay, so I'm not familiar with that dashboard. So again, we're seeing favorable trends in our data in terms of decreasing number of cases, decreasing percent of positivity in the cases. So I would say we're on an improving track at this point. So I would expect that we're going to continue to move down that scale of 50 worst counties in that dashboard.
When I went ahead and I kind of looked at the graphs for COVID cases over time, I saw that we had a specific spike in the middle of August, specifically August 27th. We had 153 positive cases, and as of yesterday, the 15th, we had 27. Do you believe that the peak that happened in August has anything to do with the school system opening back up?
We did identify some cases in Pitt County schools and continue to identify cases in Pitt County schools. What we have not identified in the K through 12 population is transmission within the school district yet. They seem to be cases that are coming from outside. Those cases would also fall into a different age bracket. There's a 0 to 17 age bracket, and that has come up a little bit over time. It's about 8 or 9% of cases right now. Prior to the reopening of the university, our number one bracket was the 25 to 49, sort of that, you know, healthy young adult, middle-aged adult, working age bracket. And then with the reopening of the university, the 18 to 24-year-old group rapidly expanded and became our number one age group. I think the reason that the higher age groups are not a larger percentage of the cases is that they've been advised since the beginning to protect themselves. They also don't circulate as much in the community. You know, I think that's a reason why those groups are a smaller percentage of our cases.
Okay, and then this next question kind of seeks clarification. So ECU, when addressing students and sending out press releases, they kind of went back and forth. At the beginning, they said when they transitioned online, students who go home, as soon as you go home, if you test positive, please let us know so that can be factored into the Pitt County cases. They went ahead and retracted that statement, released something else that said that that was not the case, that we were not including ECU cases in Pitt County numbers. So I would just like to see clarification. Are we including ECU positive cases for students, staff, and faculty in the Pitt County numbers?
Well, public health data is based on county of residence. So I would say that the vast majority of ECU cases are included in the Pitt County data, but I cannot say that 100% of them are included in the Pitt County data. We may very well have a faculty member who works here but lives in Beaufort County, short drive away, so that case would go back to their county of origin. ECU is tracking cases on campus. They have their own dashboard and they're tracking cases on campus, so that may not necessarily line up with Pitt County in terms of our county data. As I said, public health reporting, it's county reports to the state, state reports to the federal government, and that's just how it's been for a long time. So I would say that the vast majority of student, faculty, and staff cases at ECU are included in the Pitt County data, but likely not 100% of them.
Okay, and then in terms of specific places for testing, we obviously have a wide variety now. CVS now offers testing. Speaking from personal experience, I'll give FastMed as an example. So over the summer, I went and got tested at FastMed. There was practically a 2 to 3 week turnaround time when they told me that it would be in between 3 to 5 days. It took me reaching out to them to be able to get answers, and ended up coming back negative. So I guess I was under the impression that since it was negative, they were not in a rush to call me. This is not the first time that I have heard bad experiences coming specifically from FastMed or Urgent Care. I know they go through LabCorp for their testing. What would you tell anybody who is interested in getting testing? Would you direct them or would you point them in a specific direction? Would you tell them like it's really no different no matter where you go?
Yeah, it's highly dependent on the lab vendor that's used. So I don't want to steer business away from anybody or fault anybody's business. The LabCorp struggled with reagents, and their time ranged anywhere from at one point 3 to 4 days they got to, and then when they ran into reagent troubles, it got out to a week to 10 days, maybe pushing 14 days in some cases, which really almost renders the testing moot. So I think if you are looking to be tested, you need to discuss that with the provider of the testing as to what lab vendor they're using and what the expected turnaround time is. Ideally, we would want that back in, say, 3 days, it's sort of on the long end. The state website has an average turnaround time now. I think they were saying it's 3.1 days or something on the state website this morning. But that's all systems, and that is probably maybe swayed by some systems that have very rapid turnaround time. Some of the hospital systems have their own instrumentation and are running these in-house. They have some very quick turnaround time, which might be 6 hours to their long turnaround times are 16 hours at some of the hospital systems, including Vidant here in Greenville. And I think that may pull that average down a little bit. We know that some of the larger commercial labs have been out 7 days plus. So I think if you are going to get tested, discuss that with the person who's conducting your test and what the anticipated turnaround time is.
Okay. And then my last question, given that we have seen a reduction in cases and that things are starting to look like they're not going to completely fall off, but that things are definitely going down, what would you tell anybody listening, anybody watching, reading, that was concerned maybe that there might be another spike, wanting to know, okay, well, is this done? Can we return to normalcy?
Yeah, no, we're not done yet. Even in New York City, after the outbreak in New York City, which is a far greater population density than we have here in Pitt County, they had about 20% of people with antibodies for the virus. So it's been estimated that herd immunity wouldn't occur until maybe 60 or 70% of the population had antibodies. So if you said, well, hey, there are estimates that maybe 10% of the population has been infected with this. And again, everything in epidemiology is an estimate. And we know that our case count undercounts cases right now because not everybody is sick enough to get tested or doesn't get tested for one reason or another. So there's some estimates that perhaps 10% of our population, 10 to 12% of our population has already had that. So in Pitt County, that would mean maybe our real case count is 18,000. you know, as a county of 185,000, somewhere in that neighborhood. The good news in that is, I mean, in reality, our death rate is far lower than what it is now. But you know, there are probably more disease out there than what we think, but this is going to be with us for a while. We are hearing vaccine may be available perhaps as early as sometime next month, mid to late October, with some supplies available sometime between mid to late October and sometime in November. We will be given an allotment as that comes down from the federal government to the state, to the counties. It'll be given to us in a proportional allotment with a distribution strategy, which I don't know for sure, but I believe would be to target the higher risk groups, older, sicker individuals first, moving down to younger, healthier individuals over time as more vaccine becomes available.
Okay, yeah, that was going to be my leading question. Once you guys do get that allotment, how are you going to disperse it and decide who needs the vaccine and who does not?
Yeah, we've been told we'll have a very strict distribution strategy given basically from the feds to the states to us, and we will have to follow that.
Okay, thank you.
Okay, you're welcome. Thank you.
I just have one more thing for you. Since NCDHHS, that's all I have to say, selected an additional vendor to expand testing, is Pitt County going to get more testing sites as a result of that decision?
They have been talking about it, Hannah. It's not clear yet. CVS added 2 sites. The Memorial Avenue or Fire Tower Road, the one that's at the corner of Memorial Avenue and Fire Tower Road is testing down in Winterville. And the Farmville CVS has added testing as well, to my understanding, or will be in the near future adding testing there. There's been some talk about the state bringing in a contract vendor to set up a freestanding testing site that would be, you know, using federally funded dollars, similar to the way the Walmart site ran earlier in the year. So that's not quite determined yet, but we may get one through that as well.
And then have we seen anything about Labor Day, any increases?
Not yet. I guess I said our trends are headed down. Where Labor Day was last week. Yeah, last Monday, a week ago Monday. So you look maybe 10 to 14 days out, see if we have a bleb, and it may be, we may not actually see a bump. We may see more of a decrease in the slowing of the rate, if that makes sense.
Gotcha.
Okay. All right. Thank you all very much.